Correlation study of serum uric acid and lipid profile in HYPERURICEMIC patients attending Chitwan Medical College Teaching Hospital. A project work submitted to Department of Biochemistry, Chitwan Medical College, Tribhuvan University, Kathmandu, Nepal. In partial fulfillment of the requirements for the degree of Bachelor of Science in Medical Laboratory Technology (BSc MLT) by Sangam Kakshapati. 2019. TUREGD, No. 42-103-582015. Letter of Approval. On the recommendation of the supervisor Dr. Lokendra Bahadur Sapkota, the project work of Mr. Sangam Kakshapati, entitled Correlation Study of Serum Uric Acid and Lipid Profile in Hyperuricemic Patients Attending Chitwan Medical College Teaching Hospital, has been approved for the examination. This project work is submitted as a thesis to fulfill the requirement of Bachelor of Science in Medical Laboratory Technology (BSc MLT) in accordance with rules and regulations of the Institute of Medicine, Tribhuvan University, Kathmandu, Nepal. Supervisor Program Coordinator Dr. Lokendra Bahadur Sapkota, Dr. Sanjay Ray Yadav, ASST. Professor and In-Charge Associate Professor, Department of Biochemistry, Department of Biochemistry, Chitwan Medical College, Chitwan Medical College Teaching Hospital, Teaching Hospital, Tribhuvan University, Kathmandu, Tribhuvan University, Kathmandu. Date. Board of Examiners. Recommended by Principal Supervisor, ASST. Professor Dr. Lokendra Bahadur Sapkota, Department of Biochemistry, CMCTH. Coordinator, Associate Professor Dr. Sanjay Ray Yadav, B.Sc. MLT, CMCTH. Approved by Associate Professor Dr. Sanjay Ray Yadav, Chief Department of Laboratory Medicine, CMCTH. Examined by Internal Examiner. External Examiner. Letter of Recommendation. This is to certify that this project work entitled Correlation Study of Serum Uric Acid and Lipid Profile in Hyperuricemic Patients Attending Chitwan Medical College Teaching Hospital was the work by Mr. Sangam Kakshapati under my direct supervision and guidance. His observations have been checked by me from time to time. The study submitted as a project work to fulfill the requirement of Bachelor of Science in Medical Laboratory Technology (BSc MLT) is in accordance with the rules and regulations of the Institute of Medicine, Tribhuvan University, Kathmandu, Nepal. Supervisor Dr. Lokendra Bahadur Sapkota, ASST. Professor and In-Charge, Department of Biochemistry, Chitwan Medical College Teaching Hospital, Tribhuvan University, Kathmandu. Date. Acknowledgement. Apart from my efforts, the success of this study depended mainly on the encouragement and guidelines of many others. Firstly, I would like to express my deep sense of gratitude to CMCTH for providing me a platform for Bachelor in Medical Laboratory Technology and making this study possible. It is a genuine pleasure to express my deepest sense of gratitude to my mentor, philosopher and guide, Assistant Professor Dr. Lokendra Bahadur Sapkota for his guidance and support. His timely advice, meticulous scrutiny, scholarly advice and scientific approach have helped me to a great extent to accomplish this task. Without his valuable assistance, this study wouldn't have been completed. It is my radiant sentiment to place on record my best regards and deep sense of gratitude to Dr. Sanjay Ray Yadav, coordinator of BSc MLT, for his crucial guidance and essential suggestion during this study. It is my privilege to thank my seniors Ms. Akriti Adhikari, Mr. Roshan Raj Mishra and Mr. Usan Pia, whose ideas and suggestions were extremely helpful throughout my research work. I thank profusely to Mr. Sunil Shrestha, Department of Sample Collection, CMCTH, for his kind help and cooperation. I would like to extend my sincere gratitude to all the staffs, Department of Laboratory Medicine, CMCTH, for their indispensable support during my study. I would like to express sincere thanks to my friends Dipa Bastola, Sukrat Podal, Nabina Bania and unsung heroes who helped me during this study. My humble regards and thanks also goes to all the participants without whom the work would not have been completed. I feel privileged to acknowledge and thank everyone who contributed to the completion of this study. Sangam Kakshapati. Abstract. Background. High uric acid level is used to predict many diseases including metabolic syndrome. High uric acid is also a known risk factor for deterioration of renal function in chronic kidney disease. It is also as a risk factor for cardiovascular disease. The correlation of serum uric acid with lipid profile has not well studied. Aim of the study. This study was conducted to assess the correlation between serum uric acid and lipid profile among hyperuricemic patients attending CMCTH. Method. This was a hospital-based cross-sectional study carried out at CMCTH, which consists of 70 hyperuricemic patients and analyzed for serum lipid profile TCTG, HDL, LDL and VLDL. Data were analyzed using SPSS version 20. Result. All the biochemical data, serum uric acid and lipid profile, were expressed as mean plus or minus standard deviation. The mean plus or minus SD of serum uric acid is 7.66 plus or minus 1.13. The mean plus or minus SD of serum total cholesterol is 181.31 plus or minus 37.81. The mean plus or minus SD of serum triglycerides is 237.26 plus or minus 154.1. The mean plus or minus SD of LDL is 95.89 plus or minus 26.30. The mean plus or minus SD of HDL is 44.0 plus or minus 6.27. The mean plus or minus SD of VLDL is 37.15 plus or minus 14.72. Hyperuricemia was more prevalent in the age group of 41 to 60 year. Regarding gender, 60% of total population were men whereas 40% were women. The positive correlation between serum uric acid with TCTG, LDL and VLDL whereas a negative correlation between HDL. Conclusion. According to the present study, strong correlation between serum uric acid and lipid profile was reflected among the hyperuricemic patients attending CMCTH. Preventing hyperuricemia and dyslipidemia in early stages can lead to significant decrease in incidence of cardiovascular disease.